For the standard exposure mode, we first click on this button here, which is for entering that mode. Now, when I click on that, down here I am prompted to choose positions and click the exposure button. And what that means is, if for example I'm going to radiograph this tooth or set of teeth first, and I'm going to move to this position for the second, third, and end up here, I have now chosen my sequence, and by going up to this button, this little icon of a tube head where it says Start Stop Exposure, by clicking on that I enter the exposure mode. I'm now getting a sign here which says ready to take X-ray. I'm counting down from 900 seconds, which is 15 minutes, which I have to do this one shot. Normally much more time than needed. As soon as the sensor and the tube head are in place, you go ahead and take the X-ray, and in approximately 5 seconds after that, the image will appear as a rectangular thumbnail right here, and the next in the sequence, which is this position, will then go from blue to red. Now we now have two additional active buttons here. Expose previous position, which is the same thing as doing a retake, and we can also expose the next position, which is another way of saying skip forward in the sequence. So these are very handy. If I take a shot on this position and I look at the thumbnail and I have missed my region of interest, perhaps that might be the apex of the tooth maybe, or if for some reason I need to retake, perhaps I'm over or underexposed, I can hit this button, and then this position, which is red waiting for X-ray, will go back to blue, and this thumbnail will go away and this will return to red so that you can shoot again. And as many retakes as you take, they will be stacked up on that position in the template when you're finished with this mode. But this will allow you to back up and make as many retakes until you get it right. So it's very handy because you don't have to leave this mode. So if I hit this button, notice I'm jumping ahead in the sequence, and by hitting or clicking on this button, we're backing up in the sequence. And by hitting the Start Stop, I finish with this mode. Now, you actually don't have to hit the stop button. If you do the entire sequence, when you finish with the fourth and last shot, it will automatically go back to review mode, and you will see all of your thumbnails displayed here. So if you miss your last shot, another trick would be when you make this selection, always choose one additional shot, one shot more than you intend to take. You don't have to take it. You can always stop by hitting this. But what it will do is if you miss your last shot, it gives you a chance to return and retake it. So here I hit the stop button, and we are now back in the template. This is an example of what you might see after taking the exposure sequence that we just went through. The other acquisition mode is called endo mode, and as the name would imply, normally or originally was devised for root canal therapy, where multiple shots on a single tooth position are being taken. And one of the advantages of this mode is that you get a larger thumbnail as you're acquiring, so you can actually see and interpret and diagnose as you're going through this. And this is the preferred mode for a lot of practitioners. If I click on the endo button, we now have a slightly different message down here, which is saying click on the chart position for endo mode. So it's asking for a single position. If I choose this position, this would correspond to the right side, upper right side of the patient, and it is in a landscape orientation, which makes it suitable for teeth on the side of the mouth. this would be the same. And if I click on it like so, I'm immediately in the acquire mode and it's ready to shoot. And as soon as I take a shot, it'll be ready. After about 5 seconds, it will display in this area, which is fairly large, and it'll also be ready to immediately record another X-ray. And you can keep recording X-rays up until approximately 40 or so, and they will all stack on whatever position you chose. One of the big advantages to ProImage and the way its templates are made up is the fact that you can drag and drop images from one position to another, and you can also shuffle the images around within the stack, look at different ones that were taken earlier on an earlier date or earlier time in the day and so forth, bring them to the top of the stack in the template. We'll show you this in just a moment, but this is basically how this mode works, and you don't necessarily have to keep the sensor on one tooth. You might be wanting to do 2 or 3 different teeth, and if you know where they belong on the template and won't get in trouble with that, very often it's used for that purpose. Now, since I don't have a live X-ray, I can't actually take anything right now, so I'm going to end the mode by clicking on the exit endo mode icon like so. And now if I had taken 5 or 6 images, they would all be displaying. Since I didn't take even one, it simply blew up this large red square. It's still waiting for X-ray, but it's actually out of the mode. So all I can do now is close all images. In this case, I only have one. And here we are back in the review mode in the template. This is a full tooth chart, and I'd like to illustrate a few things about this just now. Notice when I click on a number of images, we get this small green border around each one that is selected. We have a few others that were already selected. And we have a couple of buttons up here: unselect all images or view the selected images. If I click on view, it opens all the ones that I just selected into what is called the image processing screen, and it is from here that we can apply a number of image enhancements through these tools, and we have a couple of key tools over here on the right. So I just wanted to point those out. We'll be getting back to those in a bit. Right now I'm going to close all of these images, and again we're back in the review. If we think that any of these are selected, such as I just selected one there, we can always unselect an image by doing that. I had also mentioned earlier about the ability to drag and drop images from one position to another. I'm going to illustrate that now. Notice just before I do that, that down here in the right hand corner of the chart we have this thing that says 1 X-ray. Now I'm going to take a number of X-rays and drag and drop them from positions over to this one position. And notice now that we have this position highlighted, down here it says 6 X-rays. So this is telling us we have 6 X-rays in a stack on this position. Now this would realistically correspond to doing multiple shots, for instance, for a root canal therapy on any given day or group of days, and you're on the same position, you're on the same tooth, showing a history of a pathology of some kind where you took a shot perhaps 1 or 2 years ago, the patient came back for another visit, you took another shot on the same tooth, and everything is kept right here on this one position. If we right click, we then have the ability to go through the sequence. We're now looking at the most recent tooth added to this position, and at the bottom we have the oldest. So by right clicking, we can sort through this stack of radiographs.